Hey guys, Dr. Davin Lim, board certified dermatologist. Today we'll be talking about thread lifting, in particular monofilament PDO threads. So stay tuned. Today I'll talk about what is thread lifting, who will benefit from it, and the pros and cons of this treatment. So first of all, what are thread lifts? Thread lifts are basically a way to either suspend or stimulate collagen in certain key areas of the face, jawline and neck in order to improve skin elasticity, firm up skin and treat wrinkles. What is the main difference between, monofilament threads and what we call suspension threads? This is the big difference. So suspension threads or barbed threads, as the name suggests, have areas of barbing, or in other words, cones or hooks that actually grip into the tissue and cause a suspension-like lift. This is very different compared to things like monofilament PDO threads. So in this video, we won't be talking about barbed threads or suspension threads, but simple monofilament PDOs. So first of all, what areas of concern can monofilament PDOs treat? Firstly, they can treat around the marionette lines over here. They can decrease the amount of jowling. It can help firm up the jawline and treat neck. So most of all, dermatologists employ that usually in the lower 1/3 of the face. In other words, from here down. It can be used off-label to treat, for example, the eyes, to give the fox eye look, for, a mild improvement when it comes to laxity of the brow. It can also treat the forehead area, but in about 90% of the time, it's usually mid to lower face and neck area. Okay, so who are good candidates for thread lifts? This is super important because not everyone is a candidate for PDO threads. They do have a finite amount of lift, and if you don't follow these rules, you will waste your money and you will not get a good result. So a thread lift is not a treatment which substitutes a facelift. Yep, so facelifts are still the gold standard, especially deep plane facelift. Thread lifts can be employed to treat mild to moderate laxity involving the lower face. Not everyone will respond. So the people who respond best are the ones who have a thick dermis. If you have a thin dermis, chances are threads won't work. If you have sun damage, elastosis, for example, if you live in Brisbane, Gold Coast, Sunshine Coast, where you see an immense amount of UV exposure, chances are your collagen, instead of being loose like this, your collagen is fragmented. Once it's fragmented, what we call elastosis. So under the microscope, you have these millions of little broken fibrils of collagen. Thread lifts will do bugger all for that. So for patients like that, other treatments such as deep peels, laser resurfacing, surgical treatments, that is the gold standard. So guys, remember, it's for mild to moderate laxity in people with a good dermal thickness and also very little in the way of sun damage. Okay, how do I employ threads? I think they actually work well in combination with certain other procedures. In particular, with procedures which heat up the collagen. So, when I'm talking about procedures which heat up the collagen to stimulate more neocollagenesis, in other words, more collagen production and more skin tightening, certain procedures such as radiofrequency microneedling. So with radiofrequency, we can talk about things like temperature, peleve, thermage, radiofrequency microneedling, whether it be through your Genius, Infinity, Intracell, Morpheus 8, all of these procedures provide heat in a controlled manner to help you stimulate collagen. Another thing which we often use is something called HIFU, or high intensity focus ultrasound, HIFU, or micro focus ultrasound. And the devices that we normally use include ultherapy and ultraformer. So in combination with threads, you've got your threads in your dermis, your subdermal area, which stimulates collagen, plus you've got a heating device that can be used, for example, 2, 4, 6 or 8 weeks down the track. It gives what's known as synergy. In other words, 1 plus 1 equals 3. So by themselves, can thread work? The answer is yes, it can. However, in combination with certain other treatments, the end result is a lot better. So that's synergistic treatments because we want more collagen stimulation and more contraction. Okay, so what does the procedure involve? So is it painful? What's the downtime? So the answer is that yes, it can be painful. Generally speaking, we like to use a numbing cream. In certain areas, we like to infiltrate with local anesthetic. In extensive areas, I know my nurses like to give the patients a tiny bit of sedation to help you with the procedure. So the procedure itself is insertion of the threads, and the level of which we want to insert is usually right in the lower dermis or in the hypodermis. That's in between the dermis and the fat layer, or in the high superficial fat layer. That's the actual line of insertion. Each thread, generally speaking, takes about between 2 to 8 seconds to insert, so it's super quick. The procedure itself takes between 5 minutes all the way up to about 90 minutes, depending on how many threads are used, the location, and how speedy your injector is. So the procedure itself, like I said, in the scheme of pain, it is uncomfortable, but there are many ways that your specialist or your nurse can actually alleviate the pain. Now, what's the recovery from it? When you read all the, articles or even websites, people go, it's a no downtime procedure. It really depends because you will have swelling, you'll have some redness. Generally speaking, makeup can be worn maybe a couple of hours later or the next day. Now, this is where the catch is. If you're using it in thin skin, for example, your neck area or an area where there's lots of vessels around here, generally speaking, you're going to get some bruising. And bruising may last up to 5 to 7 days. There are many ways to actually decrease bruising, for example, ice, compression, but generally speaking, you're going to have some bruising, which you hopefully can cover up with makeup. Okay, so how safe is this procedure? Well, PDO threads, believe it or not, comes from suture material, and this suture material has been used by surgeons for many decades. So the answer to your question is that in the context of PDO threads, there is a long safety record with this. So what are the side effects? Side effects, they are uncommon with this procedure. Once again, it's very different from suspension threads or barbed threads, because with barbed threads, generally speaking, we need to put the threads in, pull the threads to get traction, and then tie a knot and fix that thread. Generally speaking, for suspension or barbed threads, you are going to feel the knot, and there may be some thread extrusion or thread show, especially if your dermis is really thin. In the context of PDO threads, it is a very, very safe procedure, especially if the injector places it superficially. Sometimes you can get thread show. Remember, PDO actually looks blue, but the blue generally fades between 4 to 7 days. So don't be stressed if you get some superficial threads, because that will go in time. Infection is extremely rare, and things like granulation tissue and suppuration and all, generally speaking, if they're placed in the correct level and plane, that is an extremely rare event. Okay, so how long do threads last? That's a good question. Now, what you'll read is that the threads will decrease in time, right? So the threads will be broken up, usually between a period of 5 to 7 months, right? The thing is, however, the fibrosis, in other words, the tissue reaction which a thread causes, lasts for a lot longer. In fact, studies have shown that it lasts up to 48 weeks, so close to a year. Now, will you get that kind of lifting for a year? Chances are that's probably towards the upper end of what the limit is. So my view on things is that they do work. It takes between 2 to 3 months before you start seeing good changes, and they last between 6 to 12 months. So it can be repeated, let's say, at the 9-month or the 12-month mark. Or you might want to combine that with an energy device for a longer duration of efficacy. So guys, we talk about threads. What is the real science behind thread lifts and how does it actually work? So just looking back, the Koreans actually started thread lifting many, many years ago, probably about 2 decades ago. It's only in 2011, so literally 10 years ago, when mainstream PDO threads came into effect. So how do they actually work and what's the actual science behind it? So when we insert a thread, we cause what's known as a tissue reaction. So tissue reaction produces what's known as fibrosis. Fibrosis is what produces collagen. Collagen is what reduces wrinkles, tightens skin, and gives you a little bit of volume. So first of all, number one, fibrosis in the actual tissue. Number two, there's a theory that insertion of the thread also causes increase in blood vessels. And the blood vessels, with a secondary effect, compounds more collagen. Thirdly, when the threads go into the fibroseptal area, in other words, in the fat area, that also stimulates collagen production, not in your dermis, but in the fibroseptal area of the fat. So you can imagine the area of the fat actually contracts, and that may account for some of its lifting benefits because we stimulate collagen in the fat layer. Lastly, and this is kind of controversial, is that you have collateral damage, so it's controlled but minimal collateral damage to the adipose tissue, in other words, the fat layer. So when you insert it subdermally, the needle and the thread itself can cause apoptosis, in other words, destruction of the fat. So as you get older, you have descent of your fat pads and more distribution of your fat towards the lower 1/3 of your face. So in this context, the threads itself reduces fat in that area. So guys, that is the scientific background behind PDO threads. So, can threads be combined with other treatments such as Botox and dermal filler? Well, it's a little bit contentious, and it really depends. I was asked this question by Allergan a couple of weeks ago, and here's my take on things. If you are going to do dermal fillers on the same day, they are probably safe, providing the dermal filler is placed deep on bone or periosteum. So when you're looking at the mid-cheek area, generally speaking, we place filler deep. The threads are very superficial. So in that context, it can be combined on the same day. However, if they're occupying the same plane, it is best that you defer the treatment possibly between 1 to 4 weeks apart. In the context of Botox, if you're getting, for example, Botox on your wrinkles up on your forehead, frown lines, crow's feet, but then you're having threads down there, by all means, go ahead. But if you're having threads, for example, in the lower face, and you're getting Botox off-label for the lower face, you might want to space out that procedure. The reason being is that threads also cause some swelling. And if you get some swelling, you're going to get some diffusion of Botox. So the Botox that's initially placed here, when you sleep, might migrate here, and then you get a droop. So just by delaying that maybe a week or two, it accounts for a far safer procedure. Guys, I hope you liked that video. That's a really quick video on how I view PDO threads. So in summary, it's this. Number one, candidate selection is paramount. You've got to have a good expectation with what you can achieve with threads. It does not replace volume. It does not replace skin tightening procedures such as surgery or energy devices, but it can be a useful adjunct if you have mild to moderate laxity, especially on the lower 1/3 of the face. That's the first thing. The second is that it should be used best in combination with treatments that stimulate more collagen. So we talked about HIFU and we talked about RF. Thirdly, it is not a replacement for volume replacement. In other words, it does not replace fillers. With a filler, if I put in 2 mils of filler, I'm getting 2 mils or maybe even more together with collagen stimulation, especially when we're talking about collagen stimulating fillers. We're getting a reproducible increase in volume. In the context of threads, when you put in even 50 to 100 threads, the actual amount of volume in the context of collagen is not as much compared to fillers. So guys, it is very useful that we employ threads in the manner of which they are used. That way you get a good and reproducible outcome. Guys, I hope you liked the video. Please share your thoughts, subscribe, and by all means, I'll see you same place, same time next week. Bye for now.